This is the insulin pen training video for Cardiff Critical Care. It is now a requirement as part of your medicines management to complete this training for safe use of insulin in hospital. Please scan the QR code and follow the instructions below the QR code to access this training. It will take approximately an hour and 15 minutes to complete and can then be used towards your CPD hours for your revalidation. Always ensure that we are checking our prescriptions and medication against the 6 R's to reduce medication errors. If the patient is awake and is able to, they can self-administer their insulin. In cases where the patient in ITU is asleep, we would then look to give the insulin to them ourselves. Some insulin pens may be double strength vials, so please check the dose is correct before administering and ensure the patient details are on the pen as they are single patient use. And once they are opened, ensure the open date and the expiry date is kept on the pen as they expire within 30 days. Please ensure that gloves, aprons and ANTT are used to give insulin to our patients. To mix, roll between the hands and gently invert for 10 seconds. Do not shake the pen. We now have unifying safe control needles to administer insulin via insulin pens. Remove the lid of the pen and the foil. Insert the pen into the needle. You are now ready to prime the needle. Program the dial to 2 and disperse insulin by pressing the end of the pen into the blue guard around the needle. You should see the needle dispersing insulin into the blue guard. Then you can program in your dose and you are ready to inject your patient. Long-term insulin-dependent diabetic patients can form these hard lumps called lipohypertrophies in their abdomen, arms and legs in places that they inject. When patients inject into these sites, they will not get a regular absorption of insulin and get insulin boluses. Please make sure that you are rotating the sites when giving the insulin to these patients so that these hard lumps do not form, and make sure you hand over to whoever is on the shift after you to ensure that they are not using the same sites as you. As you can see here, I am feeling the abdomen for those hard lumps prior to giving my dose of insulin. I have my insulin here, which is at the programmed dose. I'm going to hold the needle at 90-degree angle and press on the end of the pen to deliver the dose. I will hold this into the patient for 10 seconds to ensure the full dose has been administered. You do not need to pinch the patient's skin when administering this dose. Flick up the safety guard to resheath the needle. Screw off the needle and put the cap back on the insulin pen. This can now be stored back in your patient's locker, and dispose of the needle in a sharps bin.